An Ayurvedic physician can treat diseases without medicine. With touch, the patient will get relieved or cured even.
So when Dr. Raghavan examines the patient's pulse, he can find out how that patient was in the womb of the mother. And then until the coffee he has had just before he came for consultation.
Dr. Raghavan Ramankutty is the colossus in the field of Ayurveda treatment. He is a Karmayogi who has devoted himself completely to the service of humanity. At the age of 80, he has the energy and stamina that can make the young person envious. Day and night, he thinks only one thought: what best to do for his patients. Sir, heartily welcome to Varivilak.
Welcome to KNDB Arayam segment of Varivilak program. Tell us about Dattatreya Ayurveda Hospital.
Dattatreya Ayurveda Hospital is a genius brainchild of Dattatreya Guru Parampara. It was established to revive the glorious Ayurveda traditions of clinical practice. We belong to a 3,500-year-old tradition. Dattatreya heritage, the earlier saints of Dattatreya heritage were direct disciples of Punarvasu Atreya Muni, who brought Ayurveda to this present glory. For 3,500 years, Dattatreya heritage has preserved the original literature of Ayurveda, its interpretations, as well as the clinical practice. So, the speciality of our institution is dealing with very complicated cases and showing the clinical wonders of Ayurveda.
Doctor, even though you have MBBS degree as well as you studied Ayurveda, but you chosen Ayurveda as a practice for your treating your patients. So why did you chosen this Ayurveda as a the mainstream of treatment?
I studied Ayurveda first as part of Veda. Ayurveda is a Vedic science, it's an Upaveda. So the terminology and the interpretation of Ayurveda is completely Vedic. So in that way we studied. And the concepts of Ayurveda so clear. There is no ambiguity at all. That is the most important thing which attracted me.
That's when you chosen this.
Yes, and the efficacy and safety of Ayurveda. Yes.
So compared to the modern treatment, how safe?
It's uncomparable.
Really. So in what aspects actually? Can you tell me clear about it?
It's the safest treatment. And understanding the person as a whole.
Oh, okay.
His mind, spirit and the body.
Good. So the mental health and spiritual and physical health all are covered.
It's a composite whole.
Okay.
That concept itself is owned by Ayurveda.
Especially we all know about that, like we don't have any side effect when we do the Ayurveda.
No side effect.
So that's one of the main advantage we can tell about that.
Safety, and it is gentle.
Okay.
Medicines can be used for a long period if required.
Okay.
That will not give any side effects at all.
Sir, what is the mode of diagnosis you follow?
Our main diagnostic tool is Nadi Pariksha. Actually, Nadi Pariksha will bring about what all systems have to be examined, what all investigations have to be done. That will give an idea. That's the importance of Nadi. Nadi is two process, pulse examination. It is Nadi Pariksha. So the Nadi is examined and the radial artery is considered as a hollow tube. Nali, tube. So that will come under cardiovascular system examination. Day-to-day things, recent past, everything we can make up Nadi Pariksha. Nadi Pariksha is actually essentially nervous system examination. That's the most important thing. According to Ayurveda, there are two hearts. One is thoracic heart, So Nadi Pariksha will give the indications from thoracic heart. And the cranial heart, which is called Upadeya Hridayam. The thoracic heart is called Heya Hridayam. The cranial heart is Upadeya Hridayam. Upadeya Hridayam give lot of information. Past events, even the Purva Janma can be made out from Upadeya.
Nadi Pariksha, that is pulse examination technique, has been beautifully preserved in our heritage, Dattatreya Parampara. If you see pulse examination technique, usually they look at the rate, rhythm, volume of the pulse. There is something called character. And in Dattatreya's technique of pulse examination, we go deep into the character of the pulse. So when Dr. Raghavan examines a patient's pulse, he can find out how that patient was in the womb of the mother. And then until the coffee he has had just before he came for consultation. The whole journey of the patient, how the disease manifested, how it developed, and what are the conditions which cause the disease to come to this particular state, everything can be unearthed through this pulse examination. He doesn't have to speak to the patient. Without the patient telling us any information, all these details required for treatment can be brought out, unraveled through pulse examination. This kind of technique is actually preserved for 3,500 years in our parampara. We not only use pulse examination for the purpose of diagnosis, we also use it for charting out the treatment modality, to find out if the patient will be a good patient, the patient is missing out any medicines, or the patient is violating in any moral aspects. Everything can be found out through the pulse examination.
So it will, I think it is better than the diagnosis method we follow in modern science.
For example, sir can look at the pulse of a patient, and if the patient is going for an ECG, without requiring the ECG machine, he can just draw the ECG by just looking at the pulse. If a patient has to be referred to an MRI for a spine examination, whatever is going to come in the MRI report, only by palpation and this pulse examination, he can write everything. That in the cervical area there is a mild degeneration, this nerve is being affected in C2, C3, everything can be found out. But what is very important for you to understand, pulse examination is not just contributing to what this technology is finding out. Technology is just an extension of our sensory output. He is able to find out much more than that. The subtle aspect, causal aspects of the body are all unearthed. That is why our treatment efficacy is so much bigger. Because that we rely a lot on our outputs of pulse examination.
I am Dr. Manju. I work in government health services. So my husband was diagnosed to have a neurological disease named chronic inflammatory demyelinating polyneuropathy in July 2016. So we were undergoing allopathic treatment for the same in a private hospital. So he had undergone plasmapheresis, IV immunoglobulin, steroid injections, and even rituximab and cyclophosphamide injections. So we were taking treatment in allopathy for the last 5 years. Then by God's grace, we came to know about Dr. Raghavan. He had, the symptoms started with paresthesia of toes and fingers, and the paresthesia progressed to weakness of all the 4 limbs. So we had to undergo almost 30 injections every 3 weeks, immunoglobulin injections, and that was too costly too. We got admitted here in 2019. So sir stopped all the injections, immunoglobulin injections were stopped. So in the 3 months, he was almost totally paralyzed. He couldn't even get up from the bed. So but after 3 months, under his treatment, he was showing a tremendous improvement. We had undergone almost 5 years of miserable life, and now by God's grace and sir's treatment, we could come back to our normal life.
So can you share some unforgettable clinical experience in your treatment history?
I have so many, but one incident which is beyond reasoning, so I cannot forget that, and it is concerned with me. My son, my third child, dropped me in the railway station for Delhi, and he came back. I was on the platform. Announcement of the train came. I was listening everything. For a period of time, I was unaware what happened. When I opened everything, the platform was empty. Train has gone. Very important function I was to attend, a symposium. It was, some providence is behind it. I was not upset. I came back home, then I got a phone that my son met with an accident and his leg was crushed. I went there, he was in the district hospital. I took him to my own professor, Dr. Alexander, was an orthopedic professor. I went there. He immediately suggested amputation. Which is the best time to amputate, below knee amputation. If you keep it like that, it will be above knee. So don't do that. Please do it immediately. I told doctor, I want to do something for him with Ayurveda. That's why I am retained here. He actually was irritated. And he told, whatever you do, it is you are doing harm to your son. I went with my son and started Dhara, important Dhara, with Guru Smarana, nothing else. Continuously for about 9 hours. In the early morning by 2 o'clock, that blue color changed to red. And he slept. Continued the Dhara. I could feel the pulse, lower limb pulse. Immediately I called, it was about 2:30. I called Dr. Alexander. He was so much irritated. All these are only your imagination, can never happen. Sir, I am bringing my son with me. Immediately I took him to him and woke him up. He was irritated initially and he looked at the legs, it was totally different. He told Raghava, I'm sorry. It is a wonder. I cannot explain. And we will take him to theatre. Theatre was ready for amputation. I took him. One sister was there. Immediately he told we will give anesthesia. My son told, I don't want anesthesia. Without anesthesia, doctors just put an incision. Immediately it broke up. There was a big clot. It was jetted out. Then he put an incision and dressed up. I did not allow him to give any antibiotic. He gave our treatment. Within 30 days, completely good. His movement is completely restored within 90 days. And I cannot forget that. Whenever I see my son, that big scar there. It's a real wonder in the light of modern medicine.
So for your son himself,
He himself is a very eminent doctor.
bring back to the normal life. Can you please explain what is the importance, what is the relevance of Ayurveda in modern times?
Actually, Ayurveda is most relevant now. The whole world is facing a crisis, health crisis. The recent epidemics, thousands are dying. This crisis, many epidemics we have handled successfully. This also we successfully handled many grave cases, gone cases in Europe. It's fully recorded. So many epidemics are going to come. It will be it's a way of life. So Ayurveda alone can save mankind, because Ayurveda can treat all patients. It is patient oriented. We are not bothered about the virus at all. We equip the person to fight it out. So that will be the most safe one and most efficient one. Only Ayurveda can do that. That's why.
That's the relevance actually right
Yes.
now. And do you have any advice to the modern and new generation practitioners like Ayurveda doctors
Most
coming?
important thing is Ayurveda is a Vedic science. It is based on intuitive experience,
Mm-hmm.
where sense organs has no role at all.
It's not from the textbook actually.
Not yes. So it is extrasensory that is to be acquired from the Guru and understand the Vedic connotation of each vocabulary used in Ayurveda. Now Panjabhuta means fire, earth, air,
Oxygen.
oxygen, all this. It is absolutely wrong. We must get the correct connotation and denotation of each vocabulary. Understanding of the vocabulary is the most important. Vata, Pitta, Kapha. Everybody say Vata, Pitta, Kapha. Very, very few people understand what it is. If they understand Vata, Pitta and Kapha, Ayurveda is very easy. We can gauge everything in that terminology.
So this is what they have to follow.
They have to follow, they have to learn. That is not in the Nadi Pariksha is not in the syllabus because nobody is to teach. Textbook, very rare indications are there. That will not convey the essence of Nadi Pariksha. Nadi Pariksha is to be taught by a learned guru to Shishya. That is not there now. That's the difference. So if they understand the greatness of Ayurveda and clinical efficiency, they will become proud of the science. Now it is not there. It is in the level of spa, oil application and panchakarma, some things are there. But no, much more than that. An Ayurvedic physician can treat diseases without medicine. With touch, the patient will get relieved or cured even. That capacity has to earn. That is by sadhana and blessings of Guru. That's the most important thing. It is self-study is not possible in Ayurveda.
Ayurveda is not a set of information that you gather. Ayurveda should become part of their life. That is when you make real clinicians. And that is how you bring back the earlier glory of Charaka and Sushruta in this present time.
So you spend a good time with us. Thanks for spending a lot of knowledge and in your treatment methodology and the new generation's advices and everything. It is very relevant to the community. And once again, thanks from the Ken TV. You're having a best of luck for all the future endeavors. Thank you.
Thank you very much for a great yajna you have done. God bless you.